Welcome back. If you want to stop smoking without the help of nicotine patches or medication, listen up. Our next guest has mastered a unique technique that can help you kick cigarettes to the curb for good. Dr. Tracy Riley is a hypnotherapist and woman behind Tracy Riley Hypnosis, and Derek Dorsey is a clinical hypnotist as well. And since you were last on the show, congratulations are in order, right? You completed your doctorate.
Yes, I did. I finished my clinical doctorate in psychology.
Well done. And for those who may not know, we were talking about this, how much schooling does that involve?
Well, after you get a bachelor's degree, which takes about 4 years.
I got one of those, 4 years, did it?
Yep, 4 years. And then I got a master's degree, that took 2 years.
Don't have one of those.
Then I did 2 years of licensure, and then a doctorate takes another 4 years. So I have 12 years of education and licensing.
Congratulations.
Yes.
That is impressive. So for your patients, though, I mean, your technique that you use, it works. But do you find that that accreditation and all that, it gives just a little bit more validity to what you're saying?
I think it does. People don't really care how much you know until they know how much you care. And I think the degree adds a sense of validity. But also for me, it was a personal goal of mine. I aged out of the foster care system. I wanted to find a way to validate myself, and in turn, I think that helps me validate others, and that was what it was all about for me.
That is awesome, and it is a great example to your patients and the people that come to your clinic. Is that look what you did and how you've gotten through. I don't want to ignore the elephant or the elephant jar in the room here.
Right.
This jar right here, if you can't see, is filled with cigarettes, ashtrays, cigarette butts, lighters. Vapes.
Chewing tobacco.
Chewing tobacco. What is this, and why do you have this? What is this?
Well, when someone comes in and they want to quit their habit, whether it be tobacco, vape, or chewing tobacco or cigarettes, one of the things I ask them to do is bring in everything you have. And it's a cathartic moment when they actually cut that umbilical and they put the last remaining habit that they have in that jar, and then we seal it up, and then we start the process.
Oh my gosh. And this is not just the first jar you've filled,
It's
right?
our second jar this year.
Second jar. So all of these things are representing patients. Now some patients might have brought 2 packs.
Sure.
But I mean, it's a physical, like you said, a physical representation of leaving it behind.
It's an action step. When they walk out, they don't have a cigarette that they can go back to. They have to go purchase them, and that's a roadblock. So we try to take out all the roadblocks.
I like this too. There's actually a safe combination on the top, so that
Not exactly.
It builds up a pressure in it so we can release the pressure and actually get the lid back off.
Oh, okay. I thought it was one of the safe, because there are some jars I've heard of people like to give themselves self-control at home on certain things, is a jar to lock something in that stays for a couple hours. But when they come to you, the hypnosis, talk a little bit about why you think it works, because it is working.
It is working, and what's different with our protocol is that we custom tailor it for each individual. So it's not a cookie cutter approach, it's an individualized personal session to what's specific to their needs and their wants.
Because as we were saying, everyone smokes for different reasons. So you hear about people saying, oh, I went to a hypnosis group session,
right?
But that's not going to work for everybody, right?
Well, each individual's unique in their own needs and wants. Some people started for a particular reason, other people's quit for a particular reason, and they start back for other reasons. So we take time, we interview the individual, and really custom tailor something to fit their needs.
I love this program, and I love that it's working, because it's such a need in our society. So many people have struggled to quit, but you're not just about quitting smoking. You guys, hypnosis works for many other situations, right?
Right.
Like what?
Right. One of the most common things that we see people for is weight release. We see them for sports performance. We see them for anxiety, childhood traumas, a lot of different things.
You said a term there that I've never heard. I've heard of weight loss, but what is weight release?
We call it weight release because when you call it weight loss, we look for things we lose. So when you lose your phone, your purse, your keys, you look for them. When you lose weight, it's a subconscious reminder to go look for that weight you've lost. But when you release something, you don't go look for it.
I love it. I love it. The semantics of it are important, because it is a mental click there.
Absolutely.
And since last time you were on, how have the results been? You getting a lot more calls?
Very successful. Phones, from the moment the last session ended, phones started to ring. We start making appointments and start helping people be tobacco free.
Well, the reason you're getting the calls is because it works. Obviously, you keep filling up jars, and yeah, like you said, if anybody even has a a thought of wanting to go back, just open the top, huh?
Absolutely.
It comes with a lifetime guarantee.
That's right. That is the best part. It comes with a lifetime guarantee, so if the first time doesn't work, they'll see you again. Thanks so much.
right.
No problem. Thank you.
Appreciate you being here. Special thanks to Tracy Riley Hypnosis for being here and sharing their services and this information. And you can learn more using this technique to stop smoking by visiting TracyRileyHypnosis.com or simply call 904-704-2527.